In the Lone Star State, we cherish our freedoms and hold our families dear. But when it comes to healthcare, the challenges we face are as diverse as our people. Every day, Texans grapple with the consequences of bad actors in the medical field. That's why we created Texas Best Docs. We're here to help families protect their loved ones and make informed healthcare decisions. Welcome back to Texas Best Docs, where we celebrate the heroes of healthcare and help Texas residents make informed healthcare decisions. I'm your host, Kaylee Pear, and today we have a very special guest with us, Jamie Lynch-Vasquez, a healthcare entrepreneur and successful owner of a medical billing company. Jamie has over 20 years of experience in the healthcare industry, and today we'll be discussing with her on insights and experiences, as well as the exciting work being done by Texas Best Docs. So Jamie, I want to thank you for joining us today. I'm so glad that you're here, speaking to us about everything, yourself included. So before we get started, tell us a little bit about yourself and, your journey in the healthcare industry.
Sure. Thanks so much for having me, Kaylee. It's a pleasure to be here today. I started in healthcare very young. I was a 14-year-old girl candy striping at the hospital, and I knew from a very early age in my life that I wanted to go in healthcare. I decided to move to Dallas in my early 20s and started my career, ran multiple multi-specialty groups for about 8 years, was the COO of a group, and decided to step out on my own. Financial healthcare has always been a passion of mine. I felt the need to give back in the medical community and help practices be successful and help them with their financials and their revenue cycle management and help them be successful in independent practice.
So dive a little bit deeper in that for people at home like me that need a little bit more explanation. So to make a practice successful, what are some of the tips that you give them?
Sure. So we help them on their revenue cycle with the insurance carriers, with the patients. It's hard. It's getting harder to collect effectively, and carriers make it so difficult for doctors to get paid for the great services they offer. So we effectively come in and we beat the carriers to death. We help them collect, the revenue that they deserve for the treatment that they provide. And we'll come in and we'll work alongside staff. We help them learn all the rules, all of the ways to overcome denials, and get those claims paid so that their practice remains viable and healthy.
Because what people don't know at home, when you get the bill and they're coming after you, you're just annoyed with the bill, right? But
Exactly.
The doctor who took really good care of you is not getting paid yet.
Yes.
So you're kind of helpful with that. That's cool.
Absolutely. And we really try to help the patients too, have the insurance carriers pay their claims and not necessarily the patients when it's the carrier's responsibility.
And again, how long have you been doing that part of it?
I started in healthcare when I was 22 years old. So I've been doing this for about 25 years.
That's awesome. And tell us a little bit about, how you know Barry and Chad and the guys behind Texas Best Docs. Like, how did you meet them? What was that journey like?
So when I started my first company, I met them about 2 years after starting that company, and we met, and they were both co-managing a large group practice in Fort Worth, Texas. And I had the pleasure of meeting them, of working with them. We worked side by side in the trenches. We worked together with a common goal in mind to make that practice successful. We worked together very closely for about 4 to 5 years. And we handled all the revenue cycle management for that practice and essentially helped that practice grow and become viable and successful.
Well, since you guys were all young in this business together, what did you learn along the way in healthcare that may be helpful for somebody at home that's watching?
To not give up. So many patients get disheartened about the fact that healthcare remains expensive. It's extremely expensive to buy insurance. And I think patients get beaten down by the fact that they feel like they have to pay all of these bills. They don't understand why they have to pay these bills on top of having to pay these huge premiums. And if you can align yourself with someone out there that can assist you in getting those bills paid, a lot of times you can get these carriers to pay what they're supposed to pay on these bills.
Yeah, I mean, because as a patient myself, it's sometimes overwhelming when you get one of those bills and you're like, what am I paying for?
Right.
You know?
Right. And patients just give up and they pay it.
Yeah.
And there's ways around it where you can, force the carriers to do the right thing.
Yeah. Because you don't think about that side of it. Like, oh, I guess I just went through insurance already. That's kind of in my head what I think. And then I'm like, well, I don't want collections coming after me.
Right. And it's pretty common for carriers to make mistakes. So really have a thorough look through, understand your bills, understand what's being processed, understand that your carrier processed your claim correctly.
Interesting. It's so, I'm glad that we're kind of having that conversation because it helps me. I'm sure it's helping somebody at home as well. But when it comes to some of that stuff, it's not like anybody's out to get you, but there's some holes in the healthcare industry that need, we need to bring to light to help the people at home. And Texas Best Docs is kind of doing that. And since you've known Barry and Chad for a really long time, how do you feel about what they're doing in their initiative and what Texas Best Docs is trying to do?
I feel like it's a long time coming. There's lacking information on the patient side for transparency. I believe that sometimes we know more about many different businesses, but we don't know enough about our providers. And patients walk into blind relationships with their providers. And I feel like we as people, we need to understand and have more information about the healthcare that we seek.
Yeah, I'm learning a lot through this and in this aspect of the relationship with the doctor. It's a marathon, not a sprint, and making sure that you hold them accountable as well. And there's 97% of doctors out there are amazing, but there are a few that aren't.
Right.
So being able to look at that. So with Texas Best Docs, I know that there's a lot of experiences out there. I'm sure, we asked those of you at home if you've been through something in regards to in the healthcare industry that maybe wasn't the most ideal situation. We probably get a lot of people commenting. So if you do want to reach out to us, you can send us a message as well. But why is Texas Best Docs, important to you personally?
I personally went through my own story. I was a young girl, a young woman. I was 19 years old. I went through a very difficult time in my life where I had a physical at my job, and I was one of 6 women that got impacted by an inappropriate physical by a physician. And that was very difficult for me to go through. And there was a period of time where I stayed silent about that. And thankfully, one of the other women came forward in the organization and said, hey, I'm not going to stay silent. And that helped me be open about my own story. And we were one of 6 women, and we had to report it. And we had to go through some legal actions. And it was just a very difficult time in my life. I was a young woman. I felt like I hit rock bottom in that moment. I had to find my voice because I felt like I had to stay silent in that moment. But later learned that finding my voice is really what I needed to do for myself. I'm a huge advocate for women, for children. I'm a huge advocate for abuse survivors and speaking out and helping women identify that they're not alone. And if they go through things like that they can overcome those things and they can go on and become successful women and they can change the course of their life.
Well, first off, I want to say I'm really sorry that happened to you. And I'm really, I know that there's probably people watching that are very thankful that you are talking about it though. Because, one of the first things you said is, I didn't want to tell anybody at first. And the process, for people at home, once that other woman stood up and then you did, and the other 6 women, what was the process like after that? Do you feel like immediately the weight was lifted off, or did it take a little while?
It took time. It took time. It was scary at first. You don't know if you're going to be heard. You don't know if you can say anything. So eventually I found my voice, and it has made me stronger. Definitely as a woman, as a mother, as a business owner, as a leader with my own organization and my own employees. I feel like maybe I have a sense of understanding and empathy that I might not have otherwise.
Yeah.
And I'm a big believer in you can take your misery and make it your mission. And that's what I've done with that in my life.
Yeah, and that you along with the other 6 women probably saved a lot of other women from going through that. And, that's a physician that could have been practicing for a long time, right?
Right.
Yeah. So standing up and doing that is essentially, I feel like you are a part of the army that Texas Best Docs is really trying to protect, and continue to push forward, because there's probably a lot of stories like yours out there. Unfortunately, we hate that, right?
Right.
And we want to stop that.
Absolutely.
Give people the tools to be able to make some good decisions.
Right. Or have the knowledge before you even walk in that patient room and know the history, so that you can feel empowered. We do research on so many things we purchase, we buy, where we send our kids to school, what we allow our kids to watch on social media. But do we spend enough time getting to know our physicians before we decide to get treatment?
Mm-hmm.
So that's what I feel Texas Best Docs is long overdue. We need that. We need that as patients. We need advocates for us as patients.
And taking it a step farther, went through that as a 19-year-old and now as a mother. What kind of information or insight would you like people to know about this service from that perspective?
I love it. My daughter's 5 years old, and I love the idea of knowing that I have more confidence with her providers, knowing if she needs physicals, that I can understand the history of providers, and feeling confident that when I walk in that room, even though I may have never met that provider face-to-face, I have met that provider virtually with the information that I needed to make that decision to even schedule that visit.
Yeah. I have a 5-year-old as well, so I feel exactly the same. Yeah. Being able to kind of see through everything, and I'm doing the best I can, and that's all we can do, right, as parents, or as a daughter or sister, is to be able to do the best we can.
Absolutely. Yeah, and we beat ourselves up as moms too much, right? So I feel like we need to give ourselves more grace.
Yeah, I agree with that. And I can't say this enough on how thankful I am to have you sitting next to me. You're an inspiration. Not a lot of people can say that they stood up to that and fought for the right thing, because again, it could, you never know how it's going to end, right?
Right.
So thank you. And before we kind of wrap up this podcast, is there anything else that you would want to add, that you would want to make sure is heard today before we close out?
Yeah, I think, for young women especially, and if you've gone through those things, staying silent doesn't have to be your option. You can be successful in your life. You can go on. You can achieve great things. It has helped me become the woman that I am today. And, we are changing the culture. We're changing the mindset that you don't have to hide. And hiding and choosing not to hide is going to be what you need in your life to be able to step out and make a difference in your life. So that would be my feedback to women is just to step up, and when things happen that are not correct or that should change, find your voice. It's worth it. It will make you a stronger woman. And
is there any questions that, back, obviously it was 19 years old, but now more wisdom. Is there any questions that if you, a sister, mother, anybody to ask, like a physician, before they go in and have them be their doctor, even after this research?
Yeah, great. I think physicians are more and more open nowadays than they've ever been to being transparent, asking a physician their experience, asking a physician how long they've been in practice, talk to that doctor about how many patients they treat on a daily basis, asking their commitment to healthcare, how many procedures they've done if you're undergoing a procedure that you might be a little scared about. Mm-hmm. So, we have reached a time in America where it's okay to interview your doctor. We've always been afraid to do that, right? We don't ever ask. We think we can't ask. We stay silent. I think doctors are more than okay nowadays to answer those questions. So ask them. Feel confident about the healthcare you receive because we all deserve that.
Yeah, that's awesome. That's a great point. And again, I want to thank you so much for joining us today. Jamie, you are amazing, and the insight. And I think in regards to the story of Texas Best Docs, I mean, I think that you're exactly the person that we're trying to protect, right?
Yeah.
And moving forward, we're trying to educate people. It's not that, you can't Google. You should use them both together, and do enough research because you're putting your life in their hands, essentially. So being able to protect not only yourselves, but also your loved ones, it's imperative now.
Yes, I agree completely. Thank you for having me.
Absolutely. Thank you, Jamie. And to our listeners, just thank you for tuning in to Texas Best Docs. And please do not forget to visit our website, www.texasbestdocs.com, to get started and finding the best healthcare for your family. And as we said before, you can stay informed on your healthcare decisions at Texas Best Docs for less than a Netflix subscription. So if you have any questions or feedback, feel free to reach out to us on the website, or you can follow us on social media at Texas Best Docs on all social platforms. You've been listening to Texas Best Docs with Kaylee Pear and Jamie Lynch-Vasquez. If you enjoyed today's episode, please subscribe and leave us a review wherever you listen to your podcasts. If you have any questions you'd like answered on future podcasts, please make sure to comment below. And until next time, take care and stay healthy, Texans.